right, Dr. Yogendra, what do we have today?
Today we are here to discuss benign prostatic hyperplasia.
All right, Dr. Yogendra, can you define benign prostatic hyperplasia?
As the term itself indicates, it is benign, so it's not malignant. And hyperplasia means there is increased proliferation in the stroma and epithelial of the prostate.
All right. So, what type of patients are at more risk of developing benign prostatic hyperplasia?
Benign prostatic hyperplasia is more common in old age males.
All right. You said that it is common in old age. Why is in old age?
It will involve the pathogenesis, in which the increase in age will increase the amount of 5-alpha reductase. This enzyme will increase in both stroma and epithelial tissue of the prostate. With increase in this enzyme, there will be increasing in the number of androgen receptors, which will bind more amount of androgen, and thus this more amount of androgen will lead to increased proliferation in the prostate tissue.
All right. So, if a patient comes to you with BPH or benign prostatic hyperplasia, how would it present? How would the patient present, and how would you identify and come to your conclusive diagnosis?
Basically, under gross examination, we can appreciate nodular enlargement in the transitional zone of the prostate. And since there is an enlargement in the transitional zone, is this anatomically this zone encloses the urethra. So the patient will have complaints of frequent urination, nocturia, and strain on void, and also feeling of fullness even after urinating.
All right. So it means that because of this stasis, there might be some fever with high grade fever with rigors and chills as well.
Yeah.
Yeah.
Sometimes.
So we have to differentiate urinary tract infection as well.
Yes.
All right. Dr. Saab, can you tell us the microscopic feature of the benign prostatic hyperplasia?
On microscopic examination, we can appreciate cystically dilated glands due to increased proliferation in the stroma and glands.
All right. What are the possible treatment options for the benign prostatic hyperplasia?
The treatment involves administration of finasteride, a drug which is an inhibitor of 5-alpha reductase, along with some alpha-1 selective antagonist like tamsulosin, which will open the internal urethral sphincter.
All right. Since there is obstruction of the urine, or the patient is feeling poor streaming of the urine, what possible differentials do you have in your mind?
The differences for benign prostatic hyperplasia involves prostate cancer, or it can be due to neurogenic bladder, or also in some cases of quadricunar syndrome.
All right. Thank you very much, Dr. Yogendra, for your nice, valuable time. Hope we are going to see you again, inshallah.
My pleasure,
Thank
sir.
you.
Sure.